Well, hi, I'm Elizabeth Krause. I'm the Medical Program Director for the Medical Assistant as well as the Billing and Coding programs here at CareerPoint. We have to offer the Medical Assistant program as we help you grow within the program. We teach you all hands-on as well as book. We encourage you to go through our program, ask any questions that you need, as well as we build on your knowledge. So we're trying to encourage you to also further your education into our associate programs as well. Our medical assistant helps with the patient running through the clinics per se. They call the patient into the clinic, they take their information, they do their vital signs, get them ready and prepared for the doctor to see them. They take their past history, anything that's dealing with helping how to diagnose their symptoms as they come through the clinic for the doctor. We orientate you into the programs. We give you a kind of an understanding of what we're teaching you. We take you on a tour of the facility so you can kind of get an understanding of where things are and how we have you structured and go into which classes. We also give you a printout of the classes that you're going to as you go along. We also encourage you as you finish your first segment of classes. Say for instance, we have 4 that you have to finish at the very first part of your program. And we're so excited that you've met that we also encourage providing you a certificate saying you've met your first goal. You've completed your anatomy, you've completed your orientation, and you've completed the law and ethics class. So you've now met your first part of the program. So now we want to encourage you to continue on to the next segment. So we're always trying to reassure you that we're here for you. We're here to help you learn the right way. As when you get out there, we want to make sure that you're able to communicate with the patients. That's what they're looking for, that you're voicious, that you know how to do your vitals, how to take documentation correctly, and if you make an error, and how to correct that error before it goes any further with their documentation. We also want to make sure it's legible for the doctor to actually read off of as well, so we want to make sure we encourage that. Our program for the medical assistant is a 9-month program, and we want to help you transition into the associate program, which builds on a little bit more knowledge so you can do a little bit more like back office assistance, become a manager of a facility as well. With the changes in coding, we want to make sure that we touch base on the new format that's being given, and then encourage our students to go to the associate side, just a few more classes yet again, to encourage them to try to build on not only just being a biller and coder, but looking into the management side of it. If you split the two apart for the billing is taking the information from the clinic side and translated it into the code format. So that way when we send it off to the insurance company, the right diagnosis is with the right code that's being given. We're trying to teach our students the new coding system, which is ICD-10, and now it actually was split into 2. It's ICD-10 and then ICD-10 PC, which is the diagnosis as well. So you'll have your procedures as well as your diagnose book. And then also we've been given the CPT, and then they've upgraded that HCPCS to HCPCS 2 as opposed to HCPCS 1. So making sure that the students understand how those codes are used, how the procedure is given, how the diagnosis is given, and now it's more in depth of the location of the disease where it needs to go. There's just a slight difference for medical assistants, where medical assistants doing hands-on for vital signs, blood, giving injections, whereas a biller and coder is actually taking the information from when the MA has run through the clinic and taken all that information and plugged it into the diagnosis, procedures, and then the biller and coder is expected to make sure that the codes are matched with the symptoms of the patient. What are employers looking for? They're looking for future employees that have experience in talking with the patients, taking documentations, writing down correctly their acronyms, using abbreviations when needed. That way that they can have a real understanding of the patient before the doctor sees them, educating the patient afterwards as well. So they're looking for somebody that has all this energy. So here at CareerPoint, we're teaching them how to do that. As far as taking them to externship, also teaching them hands-on with corporations and having those corporations see what they're capable of, and a lot of them are hiring them on the spot as well.